Hi, everyone. It's Natalie. Welcome back to the podcast. Today, we're having the kind of conversation I wish I had had years ago. It's with Dr. Shereen Lim. She's not only a dentist, she's someone who has dedicated her entire career to understanding the deep link between breathing, sleep, and our overall health for ourselves and for our families. I know so many of us have tried all the things: sleep hygiene, supplements, fixing bedtime routines, maybe even snoring remedies for us or our partners. But Dr. Lim opened my eyes to how our jaw structure and how we breathe, even habits from infancy, can quietly shape our sleep quality and impact everything from brain fog to mood, energy, and those subtle signs we might just be missing. And before we get started, you are going to learn about sleep, but I want to share something I've been trying because when something actually helps, I like to talk about it here on the podcast. Sleep has been a moving target for me most of my adult life. Many of you know I worked a ridiculous shift on the morning news for many years, decades, and that really messed with my sleep and my circadian rhythm. But even after that, my body wasn't sure when it should be sleeping and when I should be wide awake. And if you're a midlife woman, you probably know what I mean. Waking up in the middle of the night, restless sleep, feeling tired even after a full night in bed. I had someone reach out to me after hearing my story, and they offered to send me some products to help. Well, I was skeptical because as a journalist, that's what I am. But if you know me, you know that I'm open to things that will improve health, and I like to do my research. This company is Blue Sky CBD. Now, hear me out. They sent me their sleep gels, and I've been taking them, and I have noticed a real difference since I started them. I take one about 30 minutes before bed, and not only does it feel easier for me to fall asleep, but my Aura sleep numbers have been trending in the right direction. And I'm a total nerd about reading those numbers every morning when I wake up. So I know that it's working. What makes these gels different is the combination of CBD and what's called CBN. CBD helps calm our nervous system, while CBN is often used specifically to support sleep. Now, together, they're designed to help your body settle into rest and a good night's rest all night without the heavier, groggy feeling that next morning. And this matters. There is no THC, nothing intoxicating, nothing addictive, not even trace amounts of it. I wanted to be sure of that. Just clean, lab tested formulas focused on better sleep. So if sleep has been harder for you to come by, I encourage you to take a look at what they offer. And they want to give my listeners 30% off of your full order. I'm really excited that they're offering this to me and to all of you, my listeners. You can't pass this up. Their website is Blue Sky CBD. It's bluesky-cbd.com, bluesky-cbd.com. Use the code Natalie30 for that discount, or you can get the link in the show notes here of the podcast. Again, bluesky-cbd.com, code Natalie30, or grab the link in the show notes. Don't forget to use the code for that discount. Please let me know how your sleep improves. I love hearing your success stories. Today's episode, all about sleep, and sometimes there are underlying issues that we don't know exist. My hope is that you will come away feeling a little less alone and more curious and ready to move on to a better night of sleep. If you find these conversations helpful, I'd love for you to subscribe to my newsletter. It is weekly. You will get more honest insights, real stories, and resources that I am personally using and loving. You can find everything at natalietisdale.com. Let's get started today with my guest, Dr. Shereen Lim. Dr. Lim, thank you for your time today.
Yeah, thanks very much for having me. It's a pleasure.
So sleep issues are so often the problem of our health, our weight, our hormones, all of those types of issues. But we don't often recognize that it's sleep issues.
Yeah, that's right. Or a very overlooked area is how well are we breathing during sleep? Because how well we are breathing will affect our sleep quality and how restored we feel.
Let's get a little bit deeper into all of this and tell me how this became a focus of your dentistry.
Yeah. About 14 years ago, my husband's snoring was driving me pretty crazy. So it got me out of bed and I started researching all about dental sleep appliances. You can get these appliances that are worn overnight that reposition the lower jaw forward, and it helps open up the airway, and it can help alleviate snoring and also obstructive sleep apnea. And I decided I was going to become one of Australia's first dentists to qualify in this area so that I could help myself and other spouses in that same frustrating
Why
situation.
is this, when you talk about this device, why is this not more common? Is it just because we're in America and you figured that out? Because I hear of mouth taping and, the CPAP machines are the big thing that
Mhm.
so many people end up having to get. But what is this device, and is it something commonly available?
Yeah, so it's an upper and lower piece that is worn inside the mouth, like it's supported by the teeth, and then it can actually put the jaw in a forward position. So as the jaw comes forward, what it does, it brings the tongue forward because the base of the tongue is a common site of airway obstruction, and it also stretches open the walls of the throat. So what this does, it helps keep the airway open. So yes, it's very well recognized, but maybe not as in the research. For example, the American Academy of Sleep Medicine or Dental Sleep Medicine, they recognize this as a frontline option for obstructive sleep apnea and snoring.
And what is that device called? Can you just search for it and buy it? And something to would you recommend it as something people try, or do they need to have a diagnosis and have this recommended for them?
Yeah. So medical legally here, you need to have a sleep study before you get one of these appliances made.
Hmm.
Um, it's better to have a custom fitted appliance. So if you can get one that is properly formed for your teeth, it's going to be the best fit and the most comfortable, and therefore it will tend to be more effective. But you can also get them over the counter. They tend to be more bulky. And so if you use one of those ones that are over the counter and it doesn't really work well, it doesn't necessarily mean that you have to rule this out as an option. But yeah, in sleep medicine, CPAP is regarded as the gold standard, but yet many people cannot tolerate it or they won't wear it all throughout the night. So this has become a frontline option to be able to manage that problem.
What is that device called?
A mandibular advancement device. Yeah. Or
Mandibular. So that
mandibular advancement splint. Yeah.
okay, okay. So let's talk about what happens.
Yeah.
So what's happening in the mouth? You mentioned the position of the tongue,
Mhm.
and is that you're saying is the most common thing that causes snoring?
Yeah. Snoring is the sound of vibration of the air as it passes through an airway narrowing. And it can really happen anywhere. It can happen from the nose down the back of the throat as well. And so there is actually, it's multifactorial. It's really related to the size of the airway, um, which is formed by the outer borders of the outer borders of the airway, sorry, are formed by our jaws. So our top jaw, it forms the floor of the nose and the space for our tongue. And it also forms the rigid support for our collapsible upper airway or our throat. So the problem can really arise in any of those areas, from the nose down the back. And the jaws have a significant contribution, as well as anything inside the airway. For instance, if there's, in children, it could be adenoids on tonsils or deviated septums or any of the things that an ENT surgeon would look inside the airway. Or it
Hmm.
can also be dictated by the function of the muscles as well. So how well is our tongue working? How strong is it? Is it sitting correctly in the roof of our mouth? Are we breathing through our nose? Are we using our nose to breathe or our mouth to breathe? Because if we use our mouth, we're going to have a more floppy airway. Everything is going to be more relaxed, all our muscles, and our tongue is more likely to be sitting low as well. So it's actually quite a multifactorial problem. And even the jaw devices that we use, it really addresses the tongue and the throat. But at the end of the day, what we don't recognize in healthcare is that nasal breathing is the key to optimal health and optimal sleep. And really, these problems with obstructive sleep apnea, they're developmental. They start from infancy and they're determined by how the jaw structures are growing, as well as how our muscles working and how we're breathing. Are we breathing through our nose, because problems really begin once mouth breathing begins.
So we hear a lot of lately about mouth taping to
Yes.
force your mouth
Yeah.
closed. Do you think that works?
In some ways, as a band-aid for adults, people are using these porous tapes to seal their lips together. And for some people, yes, it will actually help them feel better in the morning. Their sleep feels more restorative. So for some people, it will help. But really, the more ideal situation is if we can promote closed mouth nasal breathing from infancy. And that's,
So I
yeah.
know that's something you're passionate about. Is that something that if you promote that from infancy
Mhm,
and a child learns to breathe that way,
mhm.
does it prevent snoring and issues in older or midlife people?
Yes. Uh, yes, the
Mm.
key would be to promote nasal breathing from early on. Um, because if you try to snore with your mouth open and with your mouth closed, it's much easier to do so with once you start opening your mouth. Yeah.
Mm.
And so, yes, we want to establish this early on in childhood because, nasal breathing, it's really the way that we're designed to breathe. The nose is especially designed to warm, filter, and humidify the air. And then as we breathe through our nose, we will get nitric oxide from our paranasal sinuses, which is a antimicrobial, and it's also a vasodilator, so it promotes optimal oxygen exchange. But the reason why we want to pay particular attention to this in childhood is because form follows function. And so what our muscles of our mouth and our face do during rest, those light, persistent muscular forces, they really influence the way our jaw structures are going. So we know that, for instance, if a child has their mouth open or their lips apart, what's actually happening is their muscles are more relaxed and their lower jaw is swinging down and backwards. And that promotes down and backwards growth and development of the face and that more recessed jaw. Compared to if we have our mouth closed, it actually helps stimulate proper expansion of the palate as well as forward development of the face. And so why is that important? Because those jaw structures and the way that our face grows, that's really our container or our outer borders of our airway. And so we want to promote good nasal breathing so that we can
Mm-hmm.
actually have good jaw and facial development in those first 6 years of life. And that sets up our optimal airway and breathing. And so if we have closed mouth with our tongue up, that tongue up is the most stable position for our breathing as well during sleep. When everything is floppy, more collapsible, we're lying on our backs, we want that tongue up with our closed mouth nasal breathing to provide optimal and more restful sleep.
I never would have considered the um, the infancy and the childhood and the development leading to better sleep throughout your life. We just think it's something we have to deal with in midlife. But the funny thing
Mhm.
about snoring to me is that half the problem is our own and half the problem is our spouse. Because if they're snoring, you're not sleeping, and then you don't know, you half the time you don't even know if you're snoring,
That's right.
right? And unless it wakes you up because it's so loud.
Mhm.
But if you have a spouse that has a problem,
Mhm.
what would you suggest in helping them? Is a sleep study the first thing that someone should do?
Yeah. So yes, I think for an adult, which is quite different from children who I largely work with, a sleep study can be more useful to get an idea of how well we are breathing and sleeping. Because, for example, obstructive sleep apnea, it's estimated that 85% of the population that have it have not had a diagnosis.
Mm,
Um, and yet it's linked to increased risk of virtually every chronic inflammatory disease.
yeah.
And it really affects people's mental and physical health and their energy levels as well. So yes, that can actually provide some insights as to the degree of breathing. But in healthcare, uh, there's a lot of focus on end-stage problems. And obstructive sleep apnea really is an end-stage problem. To get a diagnosis, you have to stop breathing for 10 seconds or more. Uh, 5 times per hour. So an average of 5 times an hour to meet the threshold for a diagnosis of obstructive sleep apnea. And so you could go there, and there's a lot of information. When you get a sleep study, you get all these sensors and leads, and it gets all this information. But quite often it comes down to a final report with all these numbers. And unless the sleep physician is really studying and examining all that raw data, they may actually miss out more subtle breathing disturbances that are occurring. So, for instance, premenopausal women, they may be more protected from these more severe disturbances like sleep apnea because of their hormones and progesterone. It's an upper airway dilator. I mean, it helps with the dilation of our muscles. So it's quite protective of sleep apnea. And so women may not necessarily reach the arbitrary limit, but they may still be having interruptions in sleep. They may be more responsive anytime the airflow is getting restricted. There's a stress response, and it may be accompanied by grinding. So there's an arousal from sleep, grinding, it opens up the airway. It can protect us against sleep apnea. So we never entered that more prolonged collapse that is defined, that defines sleep apnea, but it's just more broken sleep. So it doesn't allow us to enter the deeper phases of sleep. And it can also lead to similar symptoms. So that unrefreshed sleep, women may present more with fatigue rather than sleepiness. They may not necessarily have snoring. It's just fatigue and feeling, unrefreshed. And a lot of it gets put down to busy lifestyles, being parents or mums, hormones. And it may play out with things like anxiety, depression, where females may be more likely to get medicated for those, or even functional somatic syndromes where we have things like IBS or chronic fatigue, myalgias, and the TMD, the jaw joint dysfunction, all those type of problems where there's low stimulus but more significant pain and dysfunction related to increased sympathetic nervous system or fight or flight response, because that breathing has become a chronic stressor night after night.
Well, that's what I was going to ask you next, and you hit on a few of these things. Is what are some of the indicators in your life that you might not be sleeping as well as you think? You mentioned anxiety, depression, maybe even weight gain, but it's so often dismissed. You think, well, I go to bed at the same time, I get up at the same time. Why would it be my sleep? But that broken sleep, what are some of the other things that you see, especially in women, that could be because of poor sleep?
Yeah, so the teeth grinding, the morning headaches, the nocturia, which is getting up to go to the toilet. Why are we getting up? Those unexplained awakenings. Yeah, feeling unrefreshed, tossing, turning, even insomnia, difficulties getting to sleep, because sometimes sleep is not particularly refreshing or peaceful. So that can lead to difficulties getting to sleep on an unconscious level. And then people may be taking supplements or sleeping aids when we haven't really looked at, is there a breathing condition?
Yeah. So talk to me about dentists diagnosing this issue, because I know that's not as common, and I love it that you do that you focus on that. But I'm wondering, because for most people, they don't know where to start. Maybe their general care doctor, but it might be overlooked by even some of those people. So is that something that people can seek out or ask their dentist if they can help them with? Or I know you have specialized training in it, but how common is that?
Yeah, well, the dentist is really in a frontline position to be able to identify many of the risk factors. So in 2017, the American Dental Association, they published a policy statement which says that dentists have a frontline role in identifying these problems in our children and in adult patients. So risk factors that that a dentist may identify in an adult is the jaw structures. We want to look if there is underdeveloped jaw structures. That is a risk factor for poor breathing. As I mentioned, it's a poor nasal passage, poor tongue space, poor support for this throat. And so what we can identify is a high arch palate. For instance, if we have a narrow palate, that is a narrow nasal passage, reduced tongue space. If we have receded jaws, that is also going to lead to a more pinched airway where there's less space for all our airway structures. So any orthodontic problems that we see where there's crooked teeth or the jaws aren't fitting in correct position, that is really an underdevelopment of our jaws or an underdevelopment of our airways, which leads to reduced airflow and increased collapsibility of our airway. So the jaw structures are a big thing. But then we can also look at the tongue. You know, one of the things that we might see is tongue scalloping. So some people will have indents on the sides of their tongue, which is a good sign that the tongue is not sitting correctly in the roof of the mouth. It's sort of sitting in between the teeth, low tongue posture. So if we have this, that has been shown to be linked to, it's predictive of obstructive sleep apnea. So that's what the research tells us. If we see that, we can probably tell that a person is not getting good sleep. We can have a look at the back of their throat and how open does it look, or if there's any blocked tonsils, if there's any signs of teeth grinding, for instance, that will actually indicate that there may be that protective response that I was talking about. So tongue tie. If the tongue is restricted, we have inability to lift correctly, and that tongue is sitting low inside our mouth. That's going to be more linked to obstructive breathing during sleep. So there's many signals inside the mouth. And in terms of what role do we as dentists have to play, we were talking about those mandibular advancement devices that bring the jaw forward. But, becoming involved in that, I can see, yes, when we address that and manage that with this nighttime solution to position the jaw forward, a lot of people, their sleep quality will improve. And I've had women tell me, they don't have this brain fog. Mentally, they feel clearer and they're able to function better. But I actually... And even though I have these qualifications, I'm no longer involved in that aspect of treatment because it really is a Band-Aid solution. We are managing poor jaw structure to get that lower jaw forward. We can actually intervene or develop the jaw structures early on in life if we pay attention doing early interceptive orthodontics, or if we actually promote better oral function. If we can actually get the muscles working better, promoting nasal breathing, good tongue posture, good tongue tone. If we get that very early on in life, it will promote those jaw structures to grow. And then we can actually promote airway health, which is 24/7, good breathing, not just something that we wear at nighttime only. Yeah. So dentists really can help to promote that through early interceptive orthodontics, recognizing that if we have crooked teeth, we don't need to wait until a child is 12 years old to have braces and straighten them. Sometimes taking teeth out, we can actually develop those jaws properly. And if we miss that boat, one of the big things that we're seeing, the big shifts that's occurring in sleep medicine, is palate expansion for adults.
For adults, see, my kids have done that, but yeah.
Yeah. So, it was thought that it wasn't possible to expand or widen the jaws in non-growing people, like in adults, because we have a mid-palate suture, and where the two halves of the palate join, and it fuses around age 9. So in very young children, we can actually separate the two halves of the palate with an orthodontic appliance. It's attached to the teeth, and there's a screw. Do you remember that?
I do remember screwing that every night with my son.
Yes. And what that does, it separates the two halves of the palate, stimulating new bone to form in the mid palate or the floor of the nose. And what that does, it alleviates obstructive sleep apnea. If there is a narrow palate, it's one part of the solution, and it also can reduce snoring as well. And so because it's so effective in children, people worked out how to do this in adults without doing invasive jaw surgery to sort of separate the two halves of the palate. You can actually use mini screws or temporary anchorage devices. What they are done is right up close to the mid palate in the roof of the mouth, you put these little mini screws they're drilled into the bone temporarily. And so then it can be used to attach an orthodontic appliance or the screw mechanism. So that screw mechanism, rather than sitting on the teeth, it's really sitting high up in the bone near that suture. And then when you turn the screw, it actually can more predictably separate the two
How
halves
long
of the
does that generally
palate.
take to happen?
Yes, it's a lot of people are getting that immediate sort of improvements in their nasal breathing within the first month. And so this is what I love to see in sleep medicine, because we are really addressing or getting to the root of the problem for adults, offering them a solution that really targets that narrow palate. Um, and it helps promote good tongue space and nasal breathing 24/7. So it's not just something that they can wear at night to minimize the breathing disturbance at nighttime. It's something that can help them all throughout the day. Because what we find is when we can get better tongue space, a lot of people can actually function better even with their eating, their chewing, their swallowing, and even just having room for their tongue to function during speech. There's a lot of benefit functionally to have this addressed. And even with that lower jaw repositioning device, uh, we can actually promote more airway health or 24/7, looking at jaw surgeries that bring the jaws forward. So there's a whole spectrum of options that, as dental professionals, if we're working together as orthodontists, maxillofacial surgeons, combining with our ENT colleagues, we can actually have more options for people so that they're not relying on these nighttime crutches like CPAP and the dental devices that bring the lower jaw forward.
The Band-Aids that
Yes.
are so common, but
Yeah.
what we're going for is just better sleep. That's where, for me, I started seeing just interrupted sleep.
Mm-hmm.
So I would be in bed for 8 hours, but only get 6. I wear an Aura ring so I
Yes.
can see
Yeah.
that I'm waking up 5, 6, 7 times a night, and my deep sleep is 30 to 40 minutes a night, which I know is not enough.
Mm-hmm.
And I think for people who aren't necessarily tracking it like I am, they just don't know that
Yes,
maybe that's what's causing so many other issues in their health.
definitely. I think we all are so busy and, not getting the best sleep hygiene a lot of the time. So we don't always
Yeah.
recognize that there could be an underlying issue.
Yeah. Okay, so for someone listening thinking, that's me, that's my husband, that's my friend, where would you tell them to start?
Yeah. So for adults, um, I guess that's one of the reasons why I actually decided to see more children, because sometimes as a dentist that I know how to identify these risk factors. But yet I only had a narrow option, these
Yeah.
dental devices, where if you go to a sleep physician, they're going to prescribe CPAP a lot of the time, you know. So you go to a dentist that's trained in these appliances, they're going to offer these appliances. And it's very hard to get someone that can recognize the full spectrum of options to be able to offer the most targeted intervention. But if I was to say who would I go to, I would probably choose, this is my opinion only, like someone that looks at adult expansion. If someone can do adult expansion to widen the upper jaw with the mini screws, the mini implants, or MARPE, if anyone wants to look it up, MARPE, one of those dentists or orthodontists that offers that is probably going to have more backgrounds in sleep. And you can look for dentists that have got credentialing with the American Academy of Dental Sleep Medicine. But anyone with that type of background that offers that solution probably also understands the various other options in terms of surgery and the CPAP and, those type of things that they're managing around, limitations. Yeah.
Well, I would suggest I'm all about the knowledge. And
Hmm.
so if you're not feeling well, for anyone listening, you're tired or your hormones are waiting, gaining weight, or you're having issues you just can't get to the root of,
Hmm.
to find out if sleep is the problem.
Yes.
There are so many ways you can do that, from trackable devices to sleep studies, and do that first, and then find someone like you're suggesting, who can help. But don't just suffer through it. That's
Hmm.
that to me. That's where I really advise people, is to find an answer or keep asking the questions.
Yeah, I would say, especially for women, really recognizing that obstructive sleep apnea is that severe end stage problem. And there are many other subtle abnormalities that can occur as well. So if you don't have a diagnosis of obstructive sleep apnea with your sleep um, study, uh, really exploring, just understanding that the key to optimal breathing is nasal breathing. Yeah. So we want to have closed mouth nasal breathing. And as much as an ENT surgeon can look inside our nose and throat and clear out anything inside it, we also want to make sure that the outer borders of the airway, our jaw structures, are really well developed if we want to have that option to have optimal health. There are new options to make sure that people can have personalized solutions that really address the root of the matter.
Yes. Well, thank you so much for the information, for educating us. I learned so much today, and I just appreciate your time.
Thanks so much, Natalie. Thanks for having me.